Hello, my name is Deborah Jehu, and I'm a postdoctoral researcher at the University of British Columbia. Today I have the pleasure to present to you a systematic review examining the influence of exercise on falls in individuals with dementia for the 2021 virtual NASPSPA conference. I'd like to acknowledge that the land on which I live, work, and play is on the unceded ancestral territory of the Coast Salish peoples, including the Musqueam, Squamish, and Tsleil-Waututh nations. Dementia was declared as a global healthcare priority in 2012 by the World Health Organization due to the rising number of cases. People living with dementia have a 2 to 3-fold increase in injurious falls, poor quality of life, poor mobility, behavioral and psychological symptoms, and increased mortality relative to intact, healthy older adults. In 2020, the cost of dementia on the American healthcare system was approximately $305 billion and is projected to increase to $1.1 trillion by the year 2050. Therefore, there's an urgent need to alleviate this growing public healthcare issue. Mounting evidence suggests that strength and balance interventions are safe and effective at reducing falls and falls risk in cognitively intact community-dwelling older adults. However, there have been a scarce number of studies that have examined the influence of exercise on falls in individuals living with dementia. A systematic review searched the literature until December 2016 and yielded only 4 studies and found no effect of exercise on falls in individuals living with dementia. Therefore, there's a need to update the evidence within the last 5 years. Therefore, the purpose of this study was to conduct a systematic review to synthesize the evidence of exercise-based interventions to prevent falls compared to usual care among individuals living with dementia. Here are the inclusion criteria for the types of studies and types of participants, as well as the exclusion criteria. Our primary outcome measure was the incident rate ratio of falls after the intervention, and secondary outcome measures included the incident rate ratio of injurious falls, the rate of falls and injurious falls, and the percentage of fallers and injurious fallers. One author searched the ALOIS, which is the Cochrane Dementia and Cognitive Improvement Group's specialized register, on August 19, 2020. The ALOIS searches a number of databases and registries on a monthly basis. 2 authors conducted the Gray literature search, including citation searching in Google Scholar and Web of Science, as well as searching the reference lists of relevant and recent systematic reviews. 2 authors screened the titles, abstracts, and full text and extracted the data. These 2 authors also examined the risk of bias with the version 2 of the Cochrane Risk of Bias tool and the quality of reporting with the Consolidated Standards of Reporting trials. A 3rd reviewer was consulted to resolve discrepancies. We organized our flow diagram based on the new 2020 PRISMA guidelines. Overall, 10 studies were eligible. Here are the study sample characteristics. The only thing I'll highlight here is that adherence was probably slightly lower, as 2 studies didn't report adherence and 2 studies only reported adherence to the group exercise program and not the home exercise component. This is the most interesting slide. Of note, only 1 study found an effect of exercise on falls in individuals living with dementia. No effects were found for the influence of exercise on injurious falls. All studies had risk of bias. Most notably, they were not powered for falls, the assessors became unblinded, short intervention durations, and inaccuracies in the falls data. Overall, the quality of reporting was generally good. Exercise does not appear to prevent falls or injurious falls in individuals living with dementia. Higher quality research is needed to determine the efficacy and effectiveness of exercise on falls and injurious falls in individuals living with dementia. Our study has limitations. Our findings are only generalizable to individuals living with dementia. And lastly, we were unable to conduct meta-analyses due to the risk of bias and heterogeneity across studies. We recommend that future trials be rigorously designed, tailor the interventions, use standardized measurement outcomes, and power the study on falls or injurious falls. Overall, identifying safe, efficacious, and cost-effective exercise-based fall prevention strategies should be considered a healthcare priority. I'd like to thank the agencies that have funded my work, and thank you for your attention.